Mr. Vick, you are now recognized for 5 minutes.
Thank you, Chairman Boss, Ranking Member Takano, and members of the committee for the opportunity to testify today at today's oversight hearing on the future of the Veterans Community Care Program on behalf of Concerned Veterans for America. CVA is a grassroots network of thousands of vets, family members, and patriotic citizens that advocates for and defends policies to preserve freedom and prosperity for all Americans. Our organization builds engaged communities of vets, elevating their unique experiences and perspectives to help improve American lives. We believe that strong and healthy vets make for strong and healthy American communities. While CVA is focused on many issues since its establishment over 14 years ago, our organization has consistently fought to empower vets to be at the center of their healthcare journey. Excuse me. As an enlisted Marine and later as a Navy officer, and now as Executive Director for CVA, I know a lot of veterans. And I have seen how the ability or inability to access quality and timely healthcare has profoundly impacted the lives of those that I've served with. That's why we advocate for choice and accountability. CVA helped elevate the voices of veteran VA whistleblowers who revealed that veterans had died while waiting for care on secret wait lists during the Phoenix VA scandal of 2014. CVA helped shape and support the 2018 Mission Act, which passed with overwhelming bipartisan support and created the Veterans Community Care Program that we're talking about today. Community care now accounts for about 40% of overall VA healthcare, and that's growing, which is a testament to both veterans' preferences and to this committee's willingness to tackle tough problems on their behalf. CVA's view of veterans' healthcare is simple. At all times, veterans should have the choice of seeking care either at a VA facility or a community care provider, depending on which best meets their needs. It's the same choice that the congressional staffers get sitting behind you, and it's the same choice that the CVA staffers get sitting behind me somewhere back there. It's also the same model that our retired military and civilians are able to use. The Community Care Network's Next Gen contract offers an important investment in sustaining the hard-won healthcare choices of the VA Mission Act and ensuring that veterans have quality choices to choose from. At the same time, members of Congress and policymakers at the VA will need to work together to ensure that the Next Gen contract is carefully and efficiently managed to limit the potential for waste, fraud, and abuse. This contract should empower the thousands of incredible people at the Department of Veterans Affairs who truly want to be a partner in getting veterans the care that they need as soon as they can get it. Veterans need these community care options. Here in DC alone, the consequences of pushing veterans away from community care and towards sole reliance on the VA would be disastrous. As of January 2026, new patient wait times for primary care at the Washington VA Medical Center were at over 35 days, according to the VA's own wait time tracking tool. This is well over the 20-day wait standard for non-specialty treatment in the community. The same query found new patient wait times of 62 days for dental care, 66 days for OB/GYN treatment, 65 days for podiatry appointments, and 56 days for oncology appointments. And that last one is for cancer. Mental health availability in DC is actually pretty decent at about 8 days. But up the road in Baltimore, it's 26 days. Phoenix is 39 days. Los Angeles is 55 days. And people that are finally ready to get mental health care treatment often just don't last that long. Rural veterans that volunteer for CVA often report the additional burden of onerous travel requirements to VHA facilities, sometimes hours away and across state lines, for an appointment that took too long to get in the first place. That is why over 84% of veterans enrollees at VHA rely on supplemental insurance outside the VA, such as Medicare, Medicaid, TRICARE, or some other private insurance. Unsurprisingly, the veterans that have other insurance also report being healthier, about 44%. So we should embrace what works. Protecting and expanding community care options is not about privatizing or otherwise eliminating the VA, so that so many veterans do rely upon. I myself utilize VA in addition to my other health insurance. This is about making VA a better partner to veterans and all the folks that treat them. So Congress and the Department of Veterans Affairs should protect and expand our veterans' treatment options and thereby prioritize dignity and agency and how each of us cares for our minds and our bodies. So thank you again for having me today. I'll try my best to answer your questions.
I now recognize myself for 5 minutes. Mr. Vick, going forward, how can VA maximize veteran input in major contract actions such as this one?
Thank you, Mr. Chairman. Notably, according to the a VA survey in 2022, which was the last year that the survey was conducted, 83% of veterans are satisfied with community care versus 69% for their VHA experiences. I do believe that, whereas VA does play a critical role, and any future administration of VA plays a critical role in contractor accountability, in all VA accountability. I would love to see a time when VA accountability didn't mean all of the oversight things that you guys do, that we do, but rather meant like VA being accountable for patient outcomes no matter where those patients get their care. But I do think a critical component of that too is surveying the people that are getting the care and following up on what their healthcare outcomes are, not just how much we spend.
What are some of the opportunities you see for expanding and improving the delivery of healthcare with this next generation contract structure?
Yeah, well, I think it's going to be critical to expand the pool of people that can treat veterans. It's always seemed crazy to me, and I've used the VA in my life, and I'm also a military reservist, so I also have access to TRICARE. So I've had multiple different kinds of insurance, and I've used them all over the country, and it always seemed crazy to me that I was not able to necessarily go to the same doctor that the rest of my family used. I think that if you can expand the pool of people that can treat our veterans, and you're layering that into the feedback that veterans give on what works best for them, and by the way, some of them absolutely prefer going to a VHA facility. But if you can track accountability for the outcomes, expand this pool, and I think most importantly, when somebody does underperform, whether it is something like electronic health records, and not getting records back on care, not making it possible to have a solid continuum of care, being able to off-ramp those contractors efficiently without a bunch of red tape, that's critical.
So also, what are some important things VA do you think VA should keep in mind when they're evaluating the proposals on these contracts to ensure the benefits are best for the veterans?
I think past performance, one of the things that community care does is lean into the existing healthcare infrastructure. Unlike the VA system, which some of these facilities were built decades ago when populations existed in different places and where specialty care existed in different parts of the system. The private healthcare industry, for instance, in Orlando, where I call home, it mirrors exactly what the local community needs, right? And so I think that being able to match that for veterans, right, and finding out exactly how to streamline service delivery directly to the vet, that's the most important thing to do.